Today, we are going to check out the best medical robots that actually save human lives. Let's dive right in and make sure to watch until the end for the most endearing medical robot. Number 8. Da Vinci. Even though it seems impossible, more than 250,000 people in the United States pass away every year due to medical mistakes. Sadly, many of those are avoidable. While this is a large area including a variety of issues, it is unquestionably true that the more control surgeons have over their procedures, the better. And there's one robot that's helping them achieve just that. A multi-armed wonderbot called Da Vinci Surgical System is being used to lower surgical errors and make surgery less intrusive for thousands of patients. The system uses enlarged 3D high-definition vision and controllers that strap to a surgeon's wrists and hands to provide them with more accurate control over a variety of procedures. Human hands might not be able to make tiny, precise incisions without the help of the Da Vinci system. This gives doctors greater control, and because the procedure is less intrusive than conventional surgery, patients recover more quickly. Da Vinci doesn't carry out operations on its own. Instead, a surgeon uses this system and devices that are controlled by a console. Still, it is one of the most useful robotic systems in use in medicine today. Number 7. Moxi. Moxi is a 4-foot-tall robot that can be left unattended in hospitals to complete time-consuming logistical duties, like setting up patient rooms. Additionally, it transports supplies, lab samples, personal items, and medications from floor to floor. Moxi is even endowed with social intelligence that is conveyed through its head movements and LED eyes, making it capable of navigating hospital corridors and other constrained areas. Moxi has a robotic arm, a digital face with hardened eyes that can coo at people passing by, a camera on the front, and a LiDAR sensor on the back. These features enable Moxi to map hospital floors and identify people and objects it should avoid. In order for its clinical staff to concentrate more on patient care, Texas Health Presbyterian Hospital in Dallas became the first U.S. hospital to utilize Moxi. Healthcare systems have already started using Moxi full-time in clinical settings, with some examples including Christiana Hospital in 2022 and the Heart and Spine Institutions in Medical City, Dallas in 2020. According to nurses in several hospitals, Moxi saves them time by eliminating the need to visit various floors to pick up medication. Number 6. Xenex. The sad reality is that hospitals are very unclean places. You might go there for treatment, only to leave with a completely new illness. Unfortunately, hospital-acquired infections, often known as HAIs, are another pervasive issue in healthcare that may be solved with robots. A robotic disinfectant called Xenex drives autonomously to patient rooms as they are being discharged and then bombards the vacant space with pulsed, full-spectrum UV rays, killing a variety of infectious germs in a matter of minutes. It's designed to reduce HAIs, such as methicillin-resistant Staphylococcus aureus, by killing the microorganisms that cause them, which can be particularly resistant to treatment. Additionally, the robot is kind of adorable. It resembles an R2-D2, but if R2-D2 was created for life-saving. So why leave the hospital room cleaning up error-prone humans when you have a robot? Definitely one of the most helpful robots in medicine. Number 5. Cyberknife. The Cyberknife robotic surgery system applies radiation therapy to tumors with sub-millimeter accuracy. Invented in the 1990s, the system is currently used for treating cancer in hospitals and cancer treatment facilities across the United States. This system is not a knife per se, but a radiation source installed on a robot that enables a tailored radiotherapy beam that quickly maneuvers and adapts. Without repositioning the patient, Cyberknife may give radiation to a tumor by adjusting itself at several minutely varied angles, targeting the tumor from all sides. The Cyberknife has made it possible to treat tumors in parts of the body like the prostate, head, neck, and liver, parts that were previously difficult to operate on surgically. The robot reduces the amount of radiation that is absorbed by healthy organs and tissues. Furthermore, it has been shown that the system is remarkably effective in the long term for prostate cancer. Number 4. Neo. Neo is a small humanoid robot designed by SoftBank Robotics to communicate with people. The robot can walk, dance, speak, and recognize faces and objects. It is equipped with several sensors. Neo can be used as a health assistant to specifically assist patients in self-diagnosis and support professionals with health trending and monitoring. The robot serves as a hub for information distribution and a platform for telemedicine, as well as for notifications, alarms, and sound detection. Neo is 12 pounds and stands 23 inches tall. One fascinating fact about this robot is that more than 13,000 units of it are used in more than 70 nations. Number 3. Tug. Moving materials like food, supplies, and other items around the hospital is a drag on efficiency. A typical 200-bed hospital is thought to carry food, linens, lab samples, garbage, and other commodities at a rate of 53 miles per day. Tug, an autonomous mobile robot created by Aethon Inc., is intended to transport supplies to locations where they are required, relieving staff members of strenuous physical labor and enabling them to concentrate on patient care. To enhance its transportation operations, the San Francisco Medical Center at Mission Bay installed 25 Tug robots when it first opened in 2015. The robots have sensors to make sure they don't collide with anything on their journey to the lab and are programmed with the hospital's floor plan. They also politely request that people move to the side as they enter crowded hallways. Microbots. This kind of medical robot is quite promising, despite being relatively new. Basically, microrobots can be engineered to penetrate both healthy and cancerous tissues. They can incorporate sensing tools that can identify elements of the chemical microenvironment of tumors and aid them to accumulate there. Additionally, microrobots can be designed to carry and distribute medications with high spatiotemporal precision while guarding against the risk of bodily fluids diluting their load. These robots could also be used to confine a drug to the required organ, reducing its negative effects, or to deliver radiation directly to a tumor. What's really intriguing here, though, is how the particles get to the targeted path. There are other approaches that might be used, but recent research has focused on using microbots with tiny, helical tails that can be guided by magnetic fields to spin through blood vessels to a precise location on the body. Pretty cool. Number 1. PARO. Not every medical issue that robots can solve is immediately life-threatening. The reality is that millions of people who are aged, unwell, or intellectually challenged experience chronic loneliness and a lack of stimulation. Dr. Takanori Shibata, a Japanese engineer, developed PARO in 2004 to enhance the quality of life while undergoing rehabilitation from surgery or receiving therapy for depression or other mental illnesses. The PARO therapeutic robot is an interactive device that resembles a young harbor seal and was created to mimic the therapeutic effects of animals without using actual animals. Animal therapy is a common tool for easing patient stress, but there are not always trained animals available to satisfy a current need. This is when the friendly animal-like PARO fits the bill. It has been demonstrated that PARO can ease patients' anxiety and reduce tension in elderly people with dementia. The fuzzy PARO can answer to its name, loves being stroked, and over time, thanks to its memory of previous contacts, develops a distinctive, endearing personality. Additionally, the robot sleeps, blinks, wiggles its flippers, and emits amusing noises, all for its owner. PARO charges by sucking on a charger shaped like a pacifier. The lifelike seal has been improving patient engagement in healthcare facilities around the world ever since. What are your thoughts regarding medical robots? Do you think they are useful, or should they leave healing to humans? Please share your thoughts in the comments section. If you enjoyed this video, please give it a thumbs up and hit the subscribe button. You can also check out our video on robots that are saving the world next.